Right. Alrighty, what is up, y'all? So today's video is on the nervous system being the most undertrained muscle. Breathwork and bodybuilding, a complete guide to autonomic nervous system regulation, recovery, digestion, and performance. How we can optimize all these. So let's get to it. The stress paradox: training, stress; contest prep, stress; deficit, stress; drugs, stress. Everything we do in bodybuilding is going to be a stressor on our body at some degree. Stress is not a bad thing, though. This is going to cause an adaptation. It's stress in the right dose. If you're hammering yourself with 2 hours of cardio, 50 sets of work, you're going to run yourself into the ground, and you're not going to be able to accrue the adaptations that are going to lead to a positive look. At the end goal of bodybuilding, it's an aesthetic sport. And what do we need to maintain our aesthetics? Good gym performance. Managing our fatigue, being able to actually function, get our meals in, have good digestion. So, again, stress is not the enemy. Unregulated stress in the nervous system stuck in go mode, or your sympathetic nervous system constantly switched on, that's the issue. So what do we do about this? We want to manage our allostatic load, so training volume, the magnitude and duration of our caloric deficit, potentially implementing refeeds to try and offset the production of reverse T3, psychological stress, prep, anxiety, body image, life stressors like your finances, job, spouse, shit like that. All contributes. Systemic inflammation from your gut, you might be eating shit that's throwing you off, seasonings, spices, condiments, food sensitivities to stuff like gluten, dairy, maybe even certain proteins, hidden infections. You could be ingesting pathogens from the food you're eating. You can get fucking like food poisoning or something. Potentially even the carrier oils in your gear you could have a allergic reaction to, or the carrier oils in your gear. Sleep debt. This is going to be cumulative over time. If you're getting 5 hours of sleep a night, it's going to add to your allostatic load because you're not recovering from the other stressors adequately. Sleep is the biggest thing for recovery. Huge deal. You need to make sure you're getting 7 to 9 hours of high quality sleep a night, or else you're just straight up shit in the bed. Next off, your stimulant load. Caffeine, your pre-workouts, clenbuterol, ephedrine, all is going to flip on that switch to be in your sympathetic drive. We want to make sure we're managing this to the best of our ability, and we flip on that switch only when needed. So, when total allosteric load is going to exceed our recovery capacity, this is when we stop progressing and start regressing. Regardless of how hard you train, how good your diet is, you simply cannot outtrain being incredibly fatigued. So, what does all this mean? We can help, assist managing our allostatic load to some degree by optimizing our digestion and switching on that parasympathetic tone. So, the gut-brain axis, how your gut and brain communicate, and why it matters for every gain that we're chasing. This is your second brain in the enteric nervous system. It's a mesh of 100 to 500 million neurons embedded in your gut wall. So it's the largest division of the peripheral nervous system. Shit's a huge deal. Neurons equivalent to a spinal cord, 5 times more neurons than a cat's entire central nervous system. This is a huge signaling hub of the human body. 90% of our serotonin is produced there, 50% of our dopamine, our GABA as well, huge portion of that. Those are all the things that are responsible for our mood regulation. So a funky gut is going to lead to a funky mood. The enteric nervous system can function completely independently of the central nervous system, uses the same neurotransmitters, it has its own glial cells, it is not a relay, it's a brain. So these are the 4 signaling pathways via which the brain and gut communicate: the neural, immune, metabolic, and endocrine. The neural is going to be through the vagal afferents. That's mainly going to be the gut to brain pathway. This signals to the nucleus tractus solitarius, the NTS hypothalamus, your amygdala, and your prefrontal cortex. 80% of the brain, or 80% of the vagal traffic is gut to brain. Inflammatory cytokines can cross the blood-brain barrier at the circumventricular organs, activate microglia, and then this is going to lead to neuroinflammation. Lipopolysaccharides from gut bacteria are going to be the primary trigger of this. What does that mean? We just want to make sure our intestinal permeability is locked in so we don't get those LPSs leaking through. Metabolic. Short-chain fatty acids such as butyrate, acetate, and propionate cross our blood-brain barrier. Butyrate is an HDAC inhibitor. What that means is it's going to increase brain-derived neurotrophic factor. So Want to make sure we get plenty of butyrate production from typically prebiotic fibers fermenting in our gut and then going to butyrate. Gut bacteria produce GABA, serotonin, and dopamine locally. Remember in the last slide, huge portion of it as well. Endocrine, gut hormones like ghrelin, GLP-1, PYY, and CCK. These all signal to the hypothalamus to regulate your hunger, satiety, and metabolism. All this is going to be disrupted in contest rep as well as with a disrupted gut. So, vagal afferents, what I said before, 80% of the communication between your gut and brain is going to be going from your gut to your brain. 20% is from brain to gut. Most of the signaling here is going one way, like we just saw. And enteroendocrine cells detect nutrients, toxins, and metabolites. This signals to the vagal terminals, then to the NTS, then to your brain. So, the vagal terminals is essentially like that one-way communication pathway. Efferent motor to brain to gut, modulates digestion, motility, immune function. This is the brain's command to the gut. Your gut is constantly telling your brain what's happening. A distressed gut produces a distressed brain, and a distressed brain cannot recover. So, what does all that mean? Dealing with potentially anxiety, depression. Some of that could be a result of a funky microbiome or environment within your gut. So, cortisol is going to lead to leaky gut, which is going to lead to stalled recovery, impaired nutrient partitioning, higher allostatic load. All in all, we're just going to be dealing with issues. Psychological or physiological stressors are going to signal hypothalamic CRH release. CRH is going to increase our mast cell degranulation in the gut lining. These mast cells release histamine, tryptase, and prostaglandins. This is going to lead to the tight junctions, the cells lining our gut wall, which is going to prevent the bad shit from getting out and the good shit from getting out. So it's pretty much everything's going out. It's kind of like the filter for your gut. It's going to increase your intestinal permeability, so lipopolysaccharides, endotoxins can translocate and essentially get into your bloodstream, and they're going to get into circulation. Lipopolysaccharides increase our TL4 receptors, which are going to increase systemic inflammation, increase interleukin-6, tumor necrosis factor alpha, and C-reactive protein. Inflammatory cytokines cross the blood-brain barrier, like we said before. It's going to increase microglial activation, neuroinflammation. Then this is going to lead to brain fog, poor sleep, impaired recovery. Huge deal. We need to really fucking dial in our gut. Small intestinal bacterial overgrowth, brain fog, and mental clarity. When gut dysbiosis is present, microbial metabolites directly impair brain function. D-lactate is produced by certain gut bacteria. Humans metabolize it poorly, crosses into our blood-brain barrier. It's going to impair your cognitive function. Histamine produced by gut bacteria from dietary histidine. If DAO and HNMT degradation is impaired, again, brain fog, headaches, anxiety. Ammonia. Urease producing bacteria convert urea to ammonia. If liver clearance is impaired, this crosses our blood-brain barrier. Astrocytes swell, and then we have cognitive impairment. All this is going to lead to, impaired cognitive function, higher degrees of inflammation. Shit we're already dealing with as bodybuilders. I don't think we need more of it. The solution to brain fog is not more stimulants or nootropics. It's treating your gut and paying attention to it, optimizing it, getting your digestion dialed in. So then maintaining vagal tone so it doesn't return. What does that mean? Well, we're about to get to it. Breathwork is a huge intervention. So these are the mechanisms, the protocols, and the evidence for using breath to retrain your nervous system. Vagal tone 101. This is what heart rate variability actually measures. Some people think this is a pretty iffy marker of recovery, and I do certainly agree, but I do see a correlation when you do implement a breathwork practice into your routine of this increasing. So it does show a positive trend of this increasing, which most likely signals that your stress management is probably improving. So the sinoatrial node has an intrinsic firing rate of 100 beats per minute. Our vagus nerve is going to inhibit it, bring our resting heart rate at 60 to 70 range. This vagal brake tightens during exhalation and loosens during inhalation, producing respiratory sinus arrhythmia, the major contributor to heart rate variability. RMSSD, what the fuck does that mean? Root mean square of successive differences, beat to beat variance in out of our intervals. So this is going to be like the interval between like your heartbeat. So this is a pure parasympathetic metric. They take, I think it's like the difference or the interval between heartbeats, and then they square that, and then they use that as a means to track this. It's like the main metric that most wearables use. The recovery tracker's metric of choice, SDNN, standard deviation of NN intervals, total HRV, both at SS. Sympathetic nervous system and parasympathetic nervous system, more useful in 24-hour Holter monitoring. That's when you have like actual heart monitor on. So there is no universal good number. The biggest thing is it's trending up over time if your shit is buried in the gutter. Resonance frequency breathing. Most of the research shows that if we're trying to optimize this vagal tone, there's not really much of like a specific technique. It's more so just kind of dialing in the actual rate of breath. So 5.5 breaths per minute synchronizes respiratory sinus arrhythmia with baroflex oscillations. No, bunch of big words. But at this resonant frequency, HRV amplitude is maximized. Each breath cycle produces the largest possible swing in heart rate. So I'm trying to aim for 5.5 breaths per minute roughly is going to maximize our HRV amplitude. So I'm going to get that shit boosted the fuck up. 10 to 20 minutes of daily practice is pretty much ideal. Morning is what I'll typically do, and then like post-workout to activate that parasympathetic nervous system again, because training is an acute stressor. It's going to increase your sympathetic drive, get yourself back down to that chill mode a lot quicker. Breathing at resonance, baroreceptors on, NTS on, nucleus ambiguous on, vagus nerve on, SA node on. This effectively exercises the vagal pathway, increasing vagal tone over time, exactly like training a muscle. This is just another thing we can train, and for 10 to 20 minutes, that's pretty low investment. 4-7-8 breathing. This is my personal favorite alongside box breathing. Both of them work incredibly well. It's really just personal preference. So the extended exhale, 4 or 8 seconds, and then a 4-second inhale is the key variable. The longer exhale than inhale activates pulmonary stretch receptors, vagal afferent firing, NTS, and then that parasympathetic activation. Essentially what that means is that longer exhale is going to increase the degree of parasympathetic activation. Step 1, inhale quietly, 4 seconds through your belly. Hold for 7 seconds. This creates a mild hypercapnic stimulus that dilates your cerebral vasculature. Exhale completely through your mouth with an audible purse lips, tongue to roof of mouth, empty completely. Repeat for 4 to 8 rounds, used post-workout, pre-bed, or during acute stress. I typically like, sleep is an issue at the end of a contest prep. Definitely helps with sleep. I'm a fat motherfucker right now, so I'm not doing it too much pre-bed. I'm knocked the fuck out by my last meal anyway. So not too much an issue. Right now it's like morning and post-workout. Pre-competition anxiety, the brain to gut pathway. Anticipatory stress, hypothalamic CRH release, the brain's stress signal, CRH, more mast cells, histamine, all that funky shit we talked about before, tryptase, prostaglandins, higher permeability and motility. You're going to be shitting your brains. Urgency, cramping, yeah, not good. Intervention, hey, chill the fuck out. Take some fucking breaths. Do your 4-7-8. Cold water face immersion can help to really chill you out. Even just like some cold water in your face in the morning, or some point in the day, it can help. It's the mammalian dive reflexes, I think what they call it. After hard sessions, sympathetic tone is elevated, cortisol is high, the body is in go mode. The speed at which you shift back to parasympathetic tone determines the amount of time we're spending recovering. Awesome example I have of this is, what did I say? My mic's almost dead. Awesome example I have of this. Immediately post-contest, I was doing fortitude training. If you guys have never heard of that, it's a full body training split. So I'm training full body every other day. The volume was relatively high. I was doing the tier 3, which was like roughly like 20 or 25 sets of workout. It was a good amount of volume. I was leaving the gym fucking wrecked. One thing I was noticing though, my heart rate was red line. It would be like 100 for like 2-3 hours after the gym. Clear sign that sympathetic nervous system is in overdrive. Well, I started doing 10 minutes of box breathing immediately post-workout. Boom, my shit's right back in the 70s, chilling. Don't feel like I'm gonna fucking die. Don't feel that sense of like anxiety. Also, I noticed my actual ability to do like task switching, get back to work after the gym, fucking flipped right on. So faster parasympathetic nervous system reactivation, faster clearance of metabolic stress, better next day readiness. You're gonna spend more time chilling, so you're ready for your next workout. Breath work can accelerate that. What's the payoff? What you get when you train your nervous system: fast recovery, better digestion, deeper sleep, and structural brain changes. So many benefits, such low-hanging fruit. So HRV guided training decisions. I'm not so big on this personally, but if you're feeling wrecked for like 3, 4, 5 days straight, you're noticing a significant decrease in your resting heart rate, then yeah, probably chill. Like when I was doing that fortitude training, my shit dipped from like 80 on my HRV to like 30, and my resting heart rate was up like 10 beats. So you can use both of those factors together alongside with how you're actually feeling. And then that could probably signal, I might need to deload, I might need to chill for a day or two. So you can use this as a rough guideline. Breathwork doesn't just help you read this data, it actively raises your HRV, expanding the amount of total cumulative allostatic load we can tolerate, and probably go for longer in a productive training block. Neuroplasticity. This is the coolest part. I see plenty of people come to me with overwhelming anxiety, stress, all that sort of shit when they've been bodybuilding for a while. And I think it comes from impaired digestive health from eating the same shit over and over again, bland diets not including pro or prebiotics, not a variety of fruits and or vegetables. You know, the list goes on and on. So this can actually help kind of get us back to baseline alongside good food choices. GABA upregulation. GABA is like the chill the fuck out neurotransmitter. So this regular breathwork practice increases tonic GABA signaling. It downregulates amygdala reactivity. It reduces our threat hypersensitivity. Same mechanism as meditation, but breathwork may produce it slightly faster via direct vagal afferent NTS to amygdala pathway. So it's just increasing that vagal tone, probably going to be a slightly faster result than just straight up meditation. And the research shows that as well. Butyrate to BDNF. Remember, BDNF, huge deal for neuroplasticity, less stress, healthier gut, more butyrate producing bacteria. Butyrate crosses the blood-brain barrier. More BDNF, hippocampal neurogenesis, synaptic plasticity, baroreflex resetting, repeated resonance breathing, increased baroreflex gain, faster, more efficient autonomic recovery from stressors. Same stress stimulus is going to result in a smaller cortisol response. So you really should regularly for a long ass time. You'll be a chill motherfucker. You'll be a monk 90% of the time. So digestion optimization. Vagal tone directly controls digestive function. You cannot separate gut health from nervous system health. This is going to be responsible for your enzyme secretion, low vagal tone, poor digestion, regardless of what you eat. Gastric motility. Low vagal tone, slow motility, small intestinal bacterial overgrowth risk from shit sitting in your gut and fermenting. Bloating and malabsorption issues are going to crop up. Barrier integrity, we're going to have higher intestinal permeability, more LPS leaking through, higher systemic inflammation. Anti-inflammatory reflex, the vagus meditates the cholinergic anti-inflammatory pathway, which is going to be responsible for decreasing tumor necrosis factor alpha and interleukin 6. I actually got this from my coach, AJ Sims. Fucking love this. Sometimes I'll do these little nicotine skin patches. I'll just pop them on the bottom of my foot, and it can increase vagal tone. It's a pathway via which you can reduce these inflammatory cytokines. And then they actually did do some research. It can help with recovering from long COVID. So that could be something to look at. The food works better when your nervous system is online. Train the vagus, improve your gut, and absorb more food, recover faster. So gut ailments and the breath connection. IBS, strong vagal insufficiency component. HRV biofeedback improves IBS symptom scores. Breathwork directly targets the autonomic dysfunction driving most of these symptoms. A lot of people will say they have some shit like IBS, but they're fucking stress ball. The question is, which causes which? I think it's a kind of self-fulfilling loop. Postprandial bloating, often vagal hypofunction with that slow motility and emptying. Pre-meal, 2 to 3 rounds of this, fucking get your shit ripping. Constipation, sympathetic dominance, slow motility again. Parasympathetic nervous system is going to recover that normal transit. morning resonant breathing and adequate hydration can help this as well. Pretty much any breathing technique, box breathing, resonant breathing, 478, any of this shit that increases our vagal tone, be hydrated, you're going to be shitting. You're going to be shitting. That's for damn sure. Food sensitivities. Low SLGA, mucosal immune defense, driven by chronic central nervous system, sympathetic nervous system dominance. Breathwork is going to restore the mucosal immunity by shifting to PNS. You know, there's like this mucosal barrier lining your gut. When that mucosal barrier starts to degrade, then shit's going to start to get through our tight junctions. That's when we start to get issues like shit leaking through into our circulation, increasing inflammation. Sleep. Lymphatic clearance is PNS mediated. Parasympathetic nervous system. Deep sleep, parasympathetic dominance. The lymphatic system clears metabolic waste from the brain. This is when your brain takes out the trash. You get shitty sleep. I mean, the correlation with all-cause mortality, beta amyloid plaque, insulin sensitivity, the list goes on and on and on. Your PM cortisol is going to be elevated with high bedtime cortisol, block your melatonin, tired but wired. Your sleep onset is going to be delayed significantly. Low PM cortisol, you're going to fall asleep quicker, melatonin rises more efficiently, sleep architecture is far deeper. 5 minutes of resonant breathing, box breathing, or 478 in bed, that's it. Your overnight HRV and your morning readiness will reflect the difference, and you will be thanking yourself. So, this could be your daily breathwork stack. Resonant breathing, you do 5.5 breaths a minute, 2 to 5 minutes upon waking, sets vagal tone for the day. Get that shit ripping. Do it before checking your phone, do it before doing anything else. Pair with some morning HRV reading. You can look at your shit, see how you're doing so far. If you're seeing that trend up, you're on the right track. Pre-workout, I'm not the biggest. I mean, I've done this a couple times. Sometimes the Wim Hof breathing, if you're feeling like, it can help kind of get you amped up, wired up. Post-workout, 478, love this shit. Whenever I do the box breathing, the 4 seconds inhale, 4 second hold, 4 second exhale, 4 second hold, I feel like I'm fucking like asphyxiating, I have to catch my breath. So I do prefer this a good deal over the 478 post-workout. Pre-bed, the resonant breathing or 478 or box breathing, I don't notice much of a difference between all of them before bed. I've tried all of them. Cold water face immersion, 15 to 30 seconds, 2-3 rounds of 478, immediate parasympathetic nervous system activation via the dive reflex. Even you can notice this with like acute stressors like doing a sauna or cold plunge, any of that stuff. You'll feel super fucking chill if you're doing it in there. Another one is gargle for 30 to 60 seconds during oral care if you have mouthwash. This is going to directly mechanically stimulate the vagus nerve. It runs along your neck, so that vibration is going to stimulate it. You can do it every morning. This is, again, low-hanging fruit. You're already putting in mouthwash. Why not do it? So, train your nervous system. Breath work is your missing piece. Your recovery, your gut, your sleep, and your stress set point all depend on the system you never trained. You're going to be thanking yourself when you do this for a couple weeks and you're feeling like super fucking chill. Cortisol down, vagal tone up, recovery up. This is the full YouTube video. Hope you guys liked it. Let me know anything you guys are wondering in the comments down below. Any topics you'd like me to cover, any questions you might have. Thank you for watching. See you in the next one. Bye-bye.